Alaikum. I am Dr. Sherene Al-Hariri, Fellowship of the Royal College of Surgeons of England. I am examiner in the Royal College of Surgeons of England for more than 15 years. I make this recording just to announce that we plan to have the MRCS Part B OSCE course in the coming 26 and 27 of September. 2024 in Cairo, Egypt, in the Vascular ART clinic, which is in the fifth settlement in the New Cairo. This course will be in 2 days. The first day, we have examination of the hip, insertion of a catheter, wound suture, history taking, and afternoon we have examination of the knee and ankle, surgical knots or deep knots, thyroid examination, salivary gland examinations, and all this done in 1 day. This complete day started from 9 to about 5 or 6 p.m. Second day, we have another stations like examination also in the shoulder and the hip, examination of spine and foot drop, airway management, cranial nerve examination and cerebellum, abdominal examination, vascular examination, peripheral vascular disease, and also order the operative list. So all these courses is run by examiner from the Royal College of Surgeons of England, which are expert in this field, and they are examiner for long time. They give you idea about what is the common mistakes or the common fault you have in during exam, either in history taken or communication skills, maybe some due to the difference between the culture or the medical education in Egypt in comparison to other country. You know that the aim of this exam is just to allow the doctor or choose the doctor which is suitable to work in England. This suitability to work in England is related to, apart from, of course, clinical skill, procedure skill is important, but also some professionals, ethics, how to deal with the patient, how to communicate with angry patient. All this we go through in the exam. So this exam is just 2 days, but complete day started from 9 to about 6 o'clock p.m. It will be Thursday and Friday, 26 and 27 in September in Cairo, Egypt. We hope that meet you there. We hope that you learn much and overcome if you have any problem in exam. So we hope that you can pass the exam easy. Best wishes and hope good luck to all.